understand how we treat from a Chinese perspective. So first of all, I'd like to address AMH. I sort of sound like a broken record because I have quite a few blog postings on it. But AMH is not an indication if you can or cannot conceive. It is a fairly good indication if IVF will work for you. So know that IVF isn't always made for everybody, and that there is plenty of opportunity to conceive with low AMH. It just might be a different path for you than IVF. That being said, I've certainly had clients come to my practice, like Gloria, who have worked with me, had low AMH, and had successful IVF cycles. Second of all, as I mentioned just a little bit before, in Chinese medicine we don't treat blood levels. In Gloria's case study sort of shows how we would treat a client coming in. So we ignore the blood levels. It's information, but it's not a treating piece of information. We're actually looking at how does the client manifest, like how is their health. And in Gloria's case, she had quite a few symptoms around her menstrual cycle. Heavy bleeding, cramping, poor cervical mucus, spotting. So those were the symptoms that we treated. When hormones are stable, when the follicle is being primed correctly for ovulation, ovulates well, and has a nice healthy corpus luteum, we have a very consistent menstrual cycle, and that to me is a good indication of ovarian health. So what we did with Gloria's case was ovarian priming, and as you can see, it took a while. It was successful, but we really made an impact on her hormones and how those hormones prime future follicles for ovulation. Lastly, I'd like to make a point. As you can see from Gloria's case, it was well a year of treatment to get her to the point where we could go into IVF. It's so important when you're in a process that's going to be a long haul that you have a treatment team, that you have family and friends, you have people around you who are going to support you. And there were many times Gloria came in to me and she'd be crying, and she'd say, I want to give up. I have no hope. I think I'm old. I think my ovaries are old. I think this is it. My days are done. I'm never going to have a child. I'm never going to be a mother. And I'd say to Gloria, it's okay. You don't have to be hopeful. You can be angry. You can be frustrated. But I'm going to hold that place for you. I'm going to hold the place of hope, because I feel that your body has the total capacity to do this. And I think for Gloria, it was a huge relief not to be hopeful. It's so key to have people behind you who can allow you to be who you need to be in that moment so that you can continue the treatment process. I really appreciate you listening. If you have any well wishes for Gloria, please post them. She's going to be having a little baby girl in a couple of weeks. And if you have any ideas for future blogs, any questions, any concepts, anything, please reach out to me. I'm interested in hearing from you. I'd really like to write and make videos that are going to be for you guys, sort of not some of the gobbledygook that's already out there on the internet. So